Many people come to fertility clinics thinking that they have a diagnosis of PCOS, either because they've had irregular periods or maybe their doctor has told them that before. However, it's important to have a full diagnosis of PCOS before we move forward because there can be other things that present with irregular periods. When we look at diagnosing PCOS, it's important to know that it's a diagnosis of exclusion. There are things we need to make sure it's not. We need to make sure your thyroid's working well, we need to make sure your prolactin level is normal, the hormones created by your brain, as well as a couple of other different hormones and chemistries. When we're looking at a diagnosis of PCOS, you actually have to have 2 out of 3 criteria. One is ovaries that appear polycystic on ultrasound, 2, irregular periods, or 3, having evidence of what we call hyperandrogenism or too much male type hormones. That can either be increased hair growth, acne, or blood tests that show higher level of those hormones. Once we've decided that you truly do have PCOS, we need to figure out the best way for you to actually achieve that baby. Sometimes you just need to take some medicines to help you ovulate and you'll be able to have intercourse or insemination depending on what the male factor is involved. Sometimes it's best for us to look at things like IVF or in vitro fertilization. If that's the case, you actually have excellent prognosis with IVF to help you achieve your goals of a family.